Hi guys, and thank you for tuning in. Ambulances. That's alright, don't worry. Ambulances, fire brigade trucks, and everything you can even think of here in Birmingham, the Emergency Services Show. My name is Alex Kepler, and this is a special edition of Group Call.
My name's Jake Rahman. I'm the founder and owner of a company called SimulationMan.com. Okay, so Simulation Man is a cooperative of companies that come together with the best medical tech on the market. And the reason why we're a cooperative is because we want to give companies the chance to flourish with development rather than be confined into a larger company. So we've got lots of tech here that we can show you. So one of the first things that we've got is this. This is life support, which is actually our brand new ALS simulator. This is a dream come true after 10 years developing our own ALS simulator. And if you could see the simulator at the moment has got an advanced airway. Okay, we can put supraglottic airways down there. We can put ET tubes, and we can ventilate that patient properly. Okay, and of course he represents somebody of the correct demographic that will probably have an acute issue or a cardiac arrest, etc. So we're trying to represent the community a bit better. But what the main thing about this mannequin is that he's durable. He will work. He's simple. He hasn't got all the bells and whistles. He will work properly to get people through an ALS course. Now, the other products that we got here are really quite cool. So if we look at this, I'm at the moment in a consultation with a Novitech, who are a company that produce some novel medical tech. This at the moment is proposed to be the world's smallest transfer ventilator. It weighs 1 kilogram. So from an EMS point of view, having this in your bag to be able to ventilate patients for long journeys or short journeys or within acute situations is fantastic. It will go as down as low as 6 kilograms and ventilate patients to low as 6 kilograms. It will ventilate adult patients over 70 kilograms plus, and it works without air, so it will use ambient air, but you can of course attach oxygen into it and an oxygen cylinder. And Novitech have also produced this as well. And Novitech have produced a cervical spine immobilization device that gets over all the issues with cervical spine immobilization. So normally with normal collars, you've got issues with access to the airway. You've got issues as well with occlusion to vessels or arteries, and you've got that issue of continuous access after you've put the collar on. With this, we've still got access to the airway. We can take it off and take it on. It doesn't include any of the vessels within there. It can be fitted to different patient sizes. With Simulation Man, we also partner a company called Generate Healthcare, and we make interactive learning environments. So this interactive learning environment could be in an ICU, it could be a waiting room in a hospital, it could be a road traffic accident, and also as well we've got didactic material that we can put on there and you can engage with. So for instance, at the moment I've got the resuscitation guidelines up here that we could go through. And we can make this didactic material much more memorable when people are using it. We also have this critical aid device. So the critical aid device is taking those situations where people would normally grab a defibrillator from a wall, but it won't turn into a cardiac arrest, okay? This has got a defibrillator in it already. So if it does turn into a cardiac arrest, it's ready. But actually it also contains telemetry as well, so it will contact back with base, okay? We know exactly what's going on there, but it contains oxygen, so you could give oxygen to a patient if they've got a respiratory distress. If the saturation goes below 85%, the oxygen level will go from 5 litres to 10 litres. It's also got ECG in there as well, so we've got ECG and pulse oximetry on there as well, and it will talk to base in real time. So Whether you're a layperson wanting to deal with an incident, or whether you are a first responder with a bit more experience, the Innovitec Sally could be for you. We see this sitting in places like large stadiums, large events, also as well within villages and safe cities, and hopefully people will adopt this in the UK, but at the moment we're here to consult on it and find out your opinion.
Hello, my name's Davin Sullivan from WASP Vehicles UK Limited. We are the UK's leading frontline ambulance converter, and I'd like to introduce to you one of our latest innovations, is the Patient Hoist. Patient Hoist is designed to take a patient from a carry chair or a wheelchair from there onto the stretcher, removing the need to lift the patient and twist, therefore reducing musculoskeletal injuries on staff.
What do you mean? Does it mean no more top and tail?
No more top and tail.
That sounds ridiculous.
So the idea really came from that this vehicle was kindly borrowed to us by Welsh Ambulance Service. We built this vehicle for them and they've allowed us to use it for the show. Talking to their clinical and trade union partners, they said to us there was one of the biggest lifts and manual handling procedures on the vehicle now is to get the patient from there to there, and asked us if we could innovate, introduce a system that could potentially remove this risk altogether, but certainly significantly reduce the risk.
What's the safe working load for this device?
Okay, so this device has a number of settings of the safe working load, but in this integration onto the vehicle, we've limited it to 150 kilograms, which is over 20 stone in weight. The reason we do put limiting factors in there is because obviously the structure is very strong, of course, but everything has a limit, and so 150 kilograms. The great thing about this is if the patient is heavier than 150 kilograms, the hoist knows this and won't lift. So you again, it's removing this risk from the situation. This is now a prototype, a working prototype, and is awaiting appraisal from Welsh Ambulance Service. And should this appraisal be successful, they're looking to introduce it onto all of their frontline vehicles going forward.
Hi, my name's Tim Barrow, and I'm the Global Product and Business Development Manager for Celox Medical. Here we have our new vented chest seal, which is called the Vented Fox Seal. If I direct you over to here, this is what the product looks like on the person. And as you can see, we have a single venting system in the middle. We also have 8 little islands around the outer circumference of the chest seal. 8 times 8 times 8 equals 512 possible venting pathways for blood or air to escape, which means the chest seal is highly unlikely to ever occlude and fail. We also have a venting tab here. Should the medical responder need to pull the dressing down to expose the wound, finger decompress and then reseal the chest seal, unlike other chest seals where they lack this particular feature and the chest seal then sticks to the glove and you'd have to get a second dressing out. So those are the main features and benefits of our product. So we have Celox granules, which was our sort of Mark 1 product. You simply tear open the packaging, pour into the wound and then apply direct pressure for 5 minutes and then put on a pressure bandage to secure. We then have our applicator, which is this product, which is the same Celox granule technology that you can put into a narrow penetrating type injury. Insert the device, take off the cap, insert the plunger, and you can then fill the cavity and then apply direct pressure for 5 minutes. So the most common product that paramedics are likely to use is a gauze-based hemostat. Our version of that is Celox Rapid, which looks like this. So this product is a non-woven gauze laminated with the Celox granules. You would insert this into the wound, identify where the point of bleeding is coming from, and then pack into the wound, making sure that you keep downward pressure on throughout the packing process. Make sure the cavity is completely filled, and then downward pressure for up to 60 seconds, then secure with a bandage.
Apart from way of application, what's the main difference and why should I use granules or I should use Celox Rapid? What's the main difference?
Great question. So, with a gauze-based hemostat, you are enabling clot formation to occur much quicker. It's very mucoadhesive, so it will stick to all of the surrounding tissue, which will help dehydrate the blood, take the fluid out of the blood. You're left with a gel-like clot, which is very robust and it's less likely to dislodge. It's also faster acting, so that's why you would normally favour the Celox Rapid hemostat over a granule-based product like the applicator. However, if it's a particularly narrow track wound, the applicator may be a better option because you can get it actually to the bottom of the wound.
My name's Sarah Hanson, I'm the International Development Manager at Briefly Limited. The product here is our Advanced Water Rescue Mannequin. It's a brand new innovation of rescue training which lets rescue teams move from rescue training straight into resuscitation. You can put him into the water and then rescue him, and it produces a full drowning scenario including pulmonary edema on the chest.
That's it, guys. Thank you so much for watching. I hope you enjoyed this episode. Do not forget to like and subscribe to the channel at www.groupcall.uk. My name is Alex Hepner, straight from the Emergency Services Show Birmingham. That was Group Call.